Hey everyone, and welcome back for another deep dive. You know, when we talk about autism, there are so many layers, and sometimes certain aspects don't get the attention they deserve.
Right.
And today we're going to really dig into one of those topics, acid reflux.
Yeah,
And before you think, oh, just a little heartburn, we've all been there, we're going beyond that.
definitely.
We're talking about the kind of acid reflux that can be surprisingly common and have a big impact, especially for individuals with autism.
You're right, and it's something we see a lot in the autism community.
Hmm.
For many people, acid reflux means the occasional heartburn. But for many individuals with autism, we're talking about something much more frequent.
Exactly.
And it can really have a significant impact on their daily lives.
It's not just a minor inconvenience, it's something that can really affect their well-being. And just so we're all on the same page, we're using the term acid reflux, but you might also hear it called GERD, gastroesophageal reflux disease. Basically, what's happening is stomach acid is flowing back up into the esophagus, and that's what causes that burning sensation we know as heartburn.
Exactly. And, while it's uncomfortable for anyone, you can imagine the added layer of difficulty for someone with autism who might have a hard time communicating that discomfort.
Oh, absolutely.
Or they might have sensory sensitivities that make certain foods unbearable. So it's a whole other ballgame.
It's like a perfect storm, right? You've
Yeah.
got these sensory sensitivities influencing what they can eat. Then the communication hurdles make it really tough to signal when they're not feeling good.
Right.
It's no wonder this topic is so important for us to understand. And the numbers paint a pretty startling picture. Get this, studies suggest that up to 70% of children with autism experience gastrointestinal issues.
Yeah, that's huge.
That's a significant number.
It is. And when you really look at it, acid reflux is a major player in those GI problems. In my own work, I see this link all the time. It's really common.
So the big question is why? Why is there this strong connection between autism and acid reflux? What's the underlying reason?
Well, it's not just one single thing. It's more like a combination of factors that can contribute to this higher prevalence of acid reflux in autistic individuals.
Okay, so it's multifaceted. Let's try to unpack those factors one by one. Our sources point to sensory sensitivities as a significant contributor, which we've touched on a bit already.
Right, and it's important to remember that sensory input can be experienced quite differently by individuals with autism.
Absolutely.
Textures, smells, even just the feeling of food in their mouths can be really intense for them, and that often leads to very selective eating habits.
It's not just picky eating, it's sensory overload.
Exactly. And because of that,
Yeah.
they might miss out on important nutrients and fiber that are really important for healthy digestion.
It's like a domino effect.
Exactly.
So, for example, you might have a child who only eats things like yogurt and mashed potatoes because those are the only textures they can handle. And while those foods are okay in moderation, they don't have the range of nutrients and fiber needed for a healthy gut.
Exactly. And that can lead to digestive issues like, you guessed it, acid reflux.
So we've got those sensory sensitivities impacting diet, but then there's another layer, right? The communication challenges,
Oh, absolutely.
which can make it even harder to figure out if someone is dealing with acid reflux.
You're right. Being able to communicate discomfort is crucial. And this is a big one where individuals with autism, especially children who haven't developed those verbal communication skills, can really struggle.
It's heartbreaking, really, when you think about it.
It
And when you look at the statistics, it's even more concerning. Our source mentions that up to 50% of autistic children have difficulty communicating their needs. Imagine that.
Wow.
That's a huge number. It really highlights just how important it is to pay attention to those subtle cues.
Absolutely.
Because a child with autism who's experiencing acid reflux, they might not be able to say, my chest hurts or my throat burns.
Exactly. They might not have the words. So recognizing those less obvious signs is going to be key, which we'll definitely delve into a little later on.
We're going to get into those telltale signs, so definitely stay tuned for that. So far, we've talked about sensory sensitivities affecting diet and communication hurdles, making it hard to express discomfort.
Right.
What's the third piece of this puzzle? What else contributes to this link between autism and acid reflux?
Well, we've talked about those sensory sensitivities leading to limited diets. But it's not just about what they're avoiding. It's also about the types of foods they might be particularly drawn to.
So you're saying their dietary preferences could actually be contributing to the problem as well?
Exactly. Think about some common acid reflux triggers. High-fat foods, spicy things, carbonated drinks. These are often big hits for individuals with autism who might crave those strong flavors or specific textures.
That makes sense.
And without enough of those gut-friendly foods, those fruits, veggies, and whole grains to balance things out, It's easy to see how acid reflux could become a real problem.
It's all about that balance, isn't it?
It really is.
And that brings us to the fourth factor, and this one might surprise some people. Medications.
Yeah, it's not always top of mind, but it's true. Certain medications that are used to manage autism symptoms can actually have side effects that contribute to acid reflux.
It's like you're trying to help in one way, but then unintentionally making things worse in another.
Yeah, it's unfortunate, but it can definitely happen. And it's not uncommon either. Our research actually shows that almost 30% of parents in one study said their child experienced acid reflux as a side effect of their medication. It's definitely something to be aware of.
That's a really good point for caregivers to bring up with their child's doctor, right?
Absolutely.
Because if a medication is contributing to their discomfort, there might be other options or ways to manage those side effects.
Exactly. The more you know, the better equipped you are to advocate for what your child needs. Open communication with your healthcare providers is so important.
Couldn't agree more. Okay, so we've talked about why acid reflux is more common in autistic individuals, but how can we actually recognize the signs? Especially when communication can be so challenging.
Yeah, that's the tricky part.
It's like we need to be detectives looking for those subtle clues.
You got it.
Yeah.
It's about being really observant, looking beyond the obvious, and really tuning into their behavior, because they might not be able to tell us what's wrong.
So what kind of things should caregivers be looking out for? What are some of those red flags?
Well, stomach pain or chest pain is a big one, but remember, they might not be able to actually verbalize, "My stomach hurts."
Right.
So look for things like clutching their stomach, arching their back, even just being unusually fussy, especially around meal times.
That makes a lot of sense. Increased irritability, especially tied to eating, that could definitely be a sign something's up.
Exactly. And pay attention to their appetite too. Are they suddenly refusing foods they used to enjoy? Have they lost interest in eating altogether? These can be signs that something's off in their digestive system.
And what about sleep? I wouldn't have necessarily connected sleep problems with acid reflux.
It's a good point. It's not always an obvious link. But think about it. If you're not feeling well, it's going to be harder to fall asleep and stay asleep.
Right.
So if you're noticing poor sleep or disrupted sleep patterns, acid reflux discomfort could actually be playing a role.
That makes total sense. Are there any other, maybe less obvious signs that caregivers should watch out for?
Definitely. Keep an ear out for persistent coughing or throat clearing.
Oh, interesting. Okay.
Remember that acid backing up into the esophagus can irritate the throat. But here's the tricky part. It's often mistaken for a cold or allergies.
So it's easy to misinterpret those symptoms.
Exactly. So if you're seeing those things, especially if they're chronic and don't seem to have another explanation, acid reflux is worth considering.
It's always better to be safe than sorry, right? If you see any concerning symptoms, definitely talk to a healthcare professional.
Absolutely. Now, I know this is a lot to take in, and you might be wondering what happens once you've connected the dots. What can you actually do to help?
Right, because knowing is only half the battle, right? What are the solutions? That's the big question, isn't it? Because once you recognize the signs of acid reflux, you want solutions. What can actually be done to help these kids feel better?
Well, the good news is that there's actually a lot that can be done to manage those acid reflux symptoms.
Okay.
And in a lot of cases, we can even significantly reduce them.
That's what we like to hear. So what kind of approaches are we talking about here? Is it as straightforward as just giving them an antacid?
Well, it can be a little more involved than that. You see, it's really about taking a multi-pronged approach,
Okay.
one that considers their individual needs and challenges, especially given the context of autism.
That makes sense. A one-size-fits-all approach probably isn't going to cut it. So where do we even begin with this multi-pronged approach? What's the first step?
Diet is always a good starting point. We've talked about how certain foods can be triggers for acid reflux.
Right.
So working with a healthcare professional, ideally, a registered dietitian can be super helpful in figuring out exactly what those trigger foods are and then managing them.
So it's not as simple as just saying no more of this food or you can't have that food. It's really about identifying those specific triggers for each individual.
Precisely because everyone's different.
Right.
What might be a trigger for one person might be perfectly fine for another.
So it's personalized nutrition.
Exactly. For some people, it might be fatty foods that are the culprit, while for others, it could be spicy foods or things like tomatoes, which are acidic.
Oh, that makes sense.
So it's really about finding what works for that specific person.
And I imagine those sensory sensitivities we discussed earlier can make things even trickier when it comes to finding suitable food alternatives.
Absolutely. It's not as easy as just saying, okay, no more pizza. You have to be creative and find alternatives that are still appealing to their senses. It requires some effort, patience, and creativity for sure, but it can make a huge difference.
Yeah. So dietary changes are definitely key. What else can caregivers do to help manage this?
Remember we talked about the importance of routine earlier.
Yeah.
That's not just for communication and behavior. It's super important for digestion, too.
So you're saying that having a predictable mealtime routine can actually help with acid reflux.
You bet. Creating that sense of predictability and keeping things calm around meal times can work wonders for managing their anxiety.
Okay.
And that, in turn, can actually help with digestion and minimize those acid reflux episodes.
It's like you're setting their body up for success.
Exactly. And it's not just what they eat, but also how they eat. Encourage them to eat slowly and chew their food well.
Okay.
Sounds simple, but it makes a difference. And here's a quick tip about posture. Encourage them to stay upright for at least 30 minutes after eating.
So no lying down for a while after lunch.
Exactly. Staying upright actually helps gravity do its thing, keeping everything flowing in the right direction, which can really reduce the chances of that acid backing up into the esophagus.
Such a small change, but so effective. I love those kinds of tips.
They can make a big difference. And of course, don't underestimate the importance of having a good healthcare team in your corner.
Of course.
Finding those professionals who understand both autism and GERD that can make all the difference in getting the right diagnosis.
Right.
A treatment plan that's tailored to their specific needs, and just that ongoing support that's so crucial.
Because it's not just about addressing the acid reflux in isolation. It's about understanding the whole picture.
Precisely. We have to look at the whole person, their unique needs. And that might mean thinking outside the box sometimes. It's not always just about medication. For example, behavioral therapy can be really helpful in addressing any eating-related anxieties or sensory aversions that might be contributing to the problem.
It's amazing how interconnected everything is, isn't it? It really highlights how important it is to have that holistic perspective.
It really does. It's about connecting those dots and finding those professionals who are all on the same page working together.
Teamwork makes the dream work, right?
Exactly.
Yeah.
And don't forget about registered dietitians. They can be amazing resources. They can create those meal plans that take everything into account.
Right.
The nutritional needs, the sensory preferences, even those potential trigger foods.
So there's a lot to think about, but it sounds like the support is out there.
Absolutely. And the more you know as a caregiver, the better prepared you are to advocate for what your child needs and work with those healthcare providers to find the best solutions. So keep learning, keep asking those questions.
Well said. We've covered a lot of ground today, everything from how prevalent acid reflux is in the autism community to how to spot those sometimes hidden signs and all those different management strategies.
It's been a journey.
It has been a deep dive for sure. And, if our listeners take away just one thing from today's conversation, I hope it's this. There is hope and there is help available.
So well said. You're not alone in this.
Yeah.
And by working together, we can make a real difference in the lives of those who are affected by acid reflux and autism.
Couldn't agree more. And to our amazing listeners, thank you for joining us for this important conversation. Until next time, keep asking those questions and keep advocating for your loved ones.